Horses and the horse environment have a positive impact on individuals with physical, cognitive, learning, or emotional challenges. There are two overarching categories that encompass equine interactions: equine-assisted activity and equine-assisted therapy. Under the category of equine-assisted activity are adaptive riding, driving, and vaulting. Just as many people enjoy the recreational benefits, leisure activities, and exercise in an equine environment, so do persons who have disabilities. In order to be successful, however, the activities and/or equipment may need to be adapted. Teaching persons with disabilities to ride a horse is called adaptive riding. In some settings, adaptive riding is still identified as therapeutic riding, but adaptive riding more accurately describes what is occurring in this activity. These riding lessons should be provided by certified instructors, specially trained to work with students with disabilities who want to learn horsemanship skills. Learning how to ride in an adapted environment can make all the difference in the daily life of a person with disabilities. Riding a horse in a group lesson develops social skills, problem solving, and paying attention. Adaptive riding can assist in caretaking skills as students learn how to care for and feed the horse, put on equipment, and take pride in how they show their horses. The purpose of this video is to raise awareness and educate the viewer about the category of equine-assisted therapy. This includes equine-assisted mental health and hippotherapy. Equine-assisted mental health provides benefits for cognitive, psychological, and emotional disorders using the horse environment in a goal-directed intervention in which a specially trained equine is an integral part of the treatment process. These treatment approaches must be provided by a licensed mental health practitioner. All state laws, professional association codes of ethics, and practice acts governing therapy must be adhered to. This video is created to emphasize concepts related to hippotherapy. The term hippotherapy comes from the Greek word hippos, meaning horse, and it literally translates to therapy using the horse's movement. Both the movement of the horse and the environment are incorporated into the plan of care for physical therapy, occupational therapy, or speech and language therapy. The goal is to address functional outcomes. There is no intention to teach riding skills or have the patient learn horsemanship competency skills. The focus is on improving daily function outside of the equine environment. The movement of the horse is the strategy, and the arena happens to be the clinic. Hippotherapy is implemented by licensed PT, OT, SLP, and their assistants under the legal requirements of their state laws, professional codes of ethics, and practice acts governing their scope of practice. Treatment sessions are typically performed in a one-on-one session with one therapist to one client. Many individuals enjoy and receive benefits from participating in typical activities involving horses. Some of these activities have secondary health benefits, but they cannot be referred to or marketed as therapy or treatment without the involvement of a physical therapist, occupational therapist, or speech-language pathologist. It is important to know the difference. Theoretical basis for hippotherapy. In hippotherapy, a horse is an integral part of a patient's therapy. The horse's walk is used as a movement to which the patient learns to adjust his or her body, resulting in better balance and coordination. Each horse has its own genetically given and trained performance of gait, which becomes a source of individual and characteristic movement impulses. As the horse walks, its body position constantly changes, and physical and sensory stimuli are transmitted to the patient. To explain this, several theoretical constructs support the clinical rationale for the use of equine movement as a treatment tool. These include theories of motor control and learning, as well as sensory processing. Motor control theory, such as dynamic systems theory, and motor learning principles, are based on the premise that movement arises from the interaction of multiple processes, including cognition and perception. There is interaction among the individual, the task, and the environment. The control of movement is a result of the coordination of many subsystems, including, for example, the musculoskeletal, central, and peripheral nervous systems, and the cardiovascular system. Motor learning occurs when the task is repeated over and over again to develop competency and proficiency. With equine movement, the repetitive action of the horse's gait pattern reinforces neuromusculoskeletal responses repeatedly. Research has shown that in 45 minutes of being on the horse while it is walking, the participant experiences 3,000 to 5,000 movement impulses that require physical responses to maintain postural control. In addition, the variety of movement patterns and positions affords the participant many opportunities to explore and experiment with new movement patterns that may be generalized to functional tasks in everyday life. The dynamic systems theory stresses the importance of understanding the body as a mechanical system. New behaviors are learned through exploration, self-organization, and selection, with variables known as control parameters which regulate and modify behaviors. Equine movement provides a wide variety of variables to challenge and stimulate the individual through velocity, direction changes, stops and starts, and position changes. Another important aspect of the horse's movement, which greatly impacts the participant's neuromotor systems, is the provision of symmetry and rhythmicity. Many patients with neurological and musculoskeletal impairments that affect their biomechanical efforts cannot generate movement that is fluid, symmetrical, or rhythmical. The horse's movement provides these qualities repeatedly, allowing the participant to experience, internalize, and respond to these perturbations and ultimately learn to initiate rhythmic movement independently. Sensory processing theories are used to explain the mechanisms by which we receive sensory stimuli from our environment, integrate the stimuli, and make a response. This response can be a motor and/or behavioral response. The internal sensory systems that are critical to normal sensory processing are the vestibular, visual, and somatosensory systems. In addition, this treatment environment provides auditory and olfactory stimulation to give information about the surroundings. The movement of the horse provides constant stimulation to the vestibular system. This movement through space allows the visual system to experience normal stimulation along with the vestibular system, as the head and trunk are moved during the walk. This facilitates integration of these sensory inputs through the vestibular ocular reflex, as the participant is encouraged to maintain visual focus while the head and body orientation changes in space relative to the horse's movement. This movement through space also enhances visual flow, which will facilitate the activation of deep postural muscles. The proprioceptive, kinesthetic, and tactile systems are also critical in the production of functional movements and sense of body in space. Variations in movement are perceived through tactile sensations of the buttocks and lower extremities against the body of the horse. Each time the horse steps, it also produces a concussive force that delivers input to the muscles and joints. Depending on the position of the participant, the force may be through the head and spinal column, through upper extremities in a weight-bearing position, or through pelvis and hips. This repetitive compression can provide a regulating effect to modulate muscle tone. For example, individuals with low muscle tone may find that the excitatory input of compression increases tone when the horse velocity is increased. For those with high tone, the repetitive vestibular and somatosensory input when the horse velocity is decreased may have a calming effect. All theoretical models of functional movement and development include the importance of the environment. The equine environment is highly motivating and arousing, encouraging new behaviors. Cognition and executive function can also be challenged. skills of planning and execution of multi-step directions can be enhanced by using equine movement as a focus and a motivator for clients with neuromusculoskeletal as well as neurobehavioral disabilities, like attention deficit hyperactivity disorder and autism spectrum disorder. These skills can transfer to other everyday activities and occupations after clients learn them in the equine environment. The sense of success and accomplishment increases self-efficacy and self-esteem, which in turn serve to improve functional outcomes.
Good job. One more time.
Biomechanical influence. Biomechanically, a walking horse imparts motion to the person sitting on its back. Each step the horse takes causes the horse's pelvis to move in a multidimensional pattern, such as anterior-posterior pelvic tilt, ventral and dorsal rotation around the spine, and lateral flexion of the horse's spine. The horse's pelvic movement is in turn translated to multidimensional movement of the individual. This multidimensional movement of the horse facilitates the contraction of the patient's core muscles of the trunk, as well as pelvic girdle and cervical spine to develop a dynamic postural stability. Proximal stability enables distal mobility. Improved trunk control provides a stable foundation to support upper and lower extremity functional activities. It is also thought that the repetitive rotation of the individual's pelvis around the horse's spine may provide some reflex-inhibiting properties that help decrease tone in spastic muscles and facilitates dissociation of the pelvis from the trunk. Arguably, the most critical piece of the puzzle of hippotherapy is the horse. Horses move, and because they do, they cause patients who are on them to move. This is one of the basic reasons that horses are invaluable partners in therapy. Therefore, the horse's movement must be trained, precise, rhythmical, symmetrical, straight, and supple to facilitate responses in the patient. Without the appropriate equine movement, therapy will not be effective for meeting treatment goals. One of the qualities critical for the ideal horse is good conformation. Conformation means that the horse has good alignment of the spine, legs, and neck. The horse must have adequate musculature, yet be flexible and fit. Another quality is the horse's ability to move symmetrically and rhythmically. The final inherent quality is a temperament that is willing, tolerant, and adaptable to the requirement of the job. From head to tail, the horse should be well put together, giving an overall picture of balance and good health. How the horse is trained and handled can have a tremendous effect on movement. The walk, a 4-beat gait, is the most commonly used gait during the treatment sessions because it is consistent and the most adaptable of the gaits. Trotting is a faster 2-beat gait. This movement is occasionally used to increase the patient's proprioceptive input, arousal, and awareness. It is imperative to create the precise horse movement needed to facilitate successful treatment and meet therapy goals. Horse training and care. Initial and ongoing training is vital for a horse utilized in hippotherapy. Appropriate use of lunging and long lining develops a fit, well-conditioned horse with a strong back and steady symmetrical movement. Training also prepares the horse to respond well to handling in order to adjust to the needs of the patient at the therapist's direction. Any horse used in the treatment environment should be accepting of all equipment, props, and/or toys that may be used in the therapy session. Like people, horses react in different and unique ways to stimuli, so each horse must be trained to provide effective movements and maintain desired behaviors. Because horses are living beings that need care, it is important to pay attention to their health, rest, feed, exercise, equipment maintenance, and fit for their health and well-being. regular riding and training is imperative to keep them fit and mentally stimulated. Turnout is important for the horse's mental well-being, and feed should be tailored to the horse's body weight, size, and individual needs. Regular veterinary care and farrier service keeps a horse sound and healthy. Equipment needs to be clean, repaired, and in good working condition. Therapy team.
Go that way.
The patient or client with disability-seeking therapy services must be evaluated and deemed appropriate to have this treatment strategy incorporated within their plan of care. Safety and the risk-benefit ratio regarding precautions and contraindications must be considered. Family support and compliance is imperative for the success of achieving treatment goals. The therapist is a licensed healthcare professional in the disciplines of PT, OT, SLP, and their state-credentialed assistants, with further education on equine movement and treatment principles of hippotherapy. In collaboration with the patient, the therapist evaluates the patient, identifies functional goals, considers precautions and contraindications for using the horse in treatment, and develops a plan of care, including discharge plan. The therapist may provide hands-on facilitation and will direct the horse handler and sidewalkers as needed to create an effective treatment session. The therapist completes family education, develops home programs, documents and bills for therapy, just as they would in any clinical setting. Sidewalkers are individuals who assist during the treatment session. Sidewalkers are trained to keep a client safe and to perform emergency dismounts if a medical emergency or accident occurs. Sidewalkers interact with clients as directed by the therapist. Sometimes they provide assistance to help a client with alignment and positioning on the horse. With some patients, they may engage, play games, socialize, and motivate. The horse handler is responsible for grooming, preparation, selection in consultation with the therapist, and fit of appropriate tack. Tack is the equipment secured to the horse for the treatment session and may include bridles, halters, pads, and a surcingle. A surcingle is a belt that holds a pad on the horse's back. The surcingle may be flat or have handles. It can also be used to attach other therapy equipment needed during the session. The horse handler also prepares and warms up the equine for the treatment session. The horse handler is trained to produce correct and varied equine movement as specified by the therapist. The horse handler must be in tune with everything that is happening during treatment in order to respond to the therapist's requests. In an emergency, the horse handler is responsible for the horse. The horse handler should be knowledgeable in horse behavior and management and skilled to produce desired equine movement patterns to ensure the best therapeutic outcomes. The veterinarian specializing in equine health should provide regular well horse checkups and vaccinations. The vet should be on call in case of injury or illness. The farrier cares for horses' feet by trimming the hooves and setting shoes as needed to prevent lameness. By caring for the horse's hooves, the farrier helps to provide the best movement and long-term health of the horse. Depending on the size of the practice, there may be additional support staff, similar to those in other private practices. A role unique to this type of practice may be an equine manager, who is responsible for acquisition, training, maintenance, and retirement of horses. The equine manager is also usually responsible for the training and supervision of horse handlers. Many facilities also offer adaptive riding and share facilities and horses with therapists. Certified riding instructors can partner with a therapist who is not as experienced with horses to select appropriate horses for specific clients and to coach the therapist with horse-related movement and skills. Some accrediting agencies may require certified personnel, like certified riding instructors, to be present during a therapy session to meet liability insurance requirements. Therapy sessions by discipline. Hippotherapy includes many techniques for a therapist's treatment toolbox. It is not a standalone therapy. Patients should be evaluated and functional goals set like any other treatment setting. Assessment will be similar to those used in the clinic. They may be more functional in order to adapt to the equine environment. Assessments are not necessarily discipline dependent, but are chosen based on client needs.
Good. Now, can I change how you hold this?
Assessments include, but are not limited to, body structure tests such as range of motion, manual muscle tests, and observational gait analysis to assess temporal distance factors. Tests of function, such as sitting and standing balance using time as a measure, are quick and reliable measures. The 5 times sit to stand, as well as the sensory profile, are easily applied within the equine environment. Activity measures include the activity scale for kids, functional gait measures such as timed up and go, timed up and down stairs, and activity tests such as timed walk tests, and the Vineland Adaptive Behavior Scale, which can be used in this environment without modification. Participation measures frequently used in this practice setting include the Canadian Occupational Performance Measure, as well as standardized questionnaires such as the Pediatric Quality of Life, general and disease-specific versions. These next videos provide examples of treatments incorporating hippotherapy for the disciplines of physical, occupational, and speech therapy. Physical therapy. Physical therapists may incorporate activities to improve range of motion of the lower extremities. Examples include stretch on the adductors to straddle the width of the horse, gravity assisting with lengthening of hamstrings, along with manual stretching of the lower extremities while on the horse. Supine position on the moving horse opens the entire chest wall, along with improving scapular retractions and lengthening pectoral muscles. If the lower extremities are allowed to straddle the back of the horse, this provides a stretch on the hip flexors. Strengthening activities include the use of weights for upper extremities with varying lever arms, tossing balls, sit-to-stand transition using stirrups, and standing in stirrups. The movement through space in and of itself provides facilitation of core musculature. This can be enhanced with stop and starts of the horse, encouraging agonist and antagonist coupling. The horse provides one of the best mediums for enhancing postural control by developing sensory motor function. Therapists can manipulate environmental cues by asking the client to close their eyes, promoting the use of vestibular and somatosensory systems. By having the client sit sideways or backward, the therapist provides atypical visual cues, allowing the patient to practice filtering sensory information for postural control. Additional developmental positions on the moving horse promotes further somatosensory mapping to promote body awareness and assist in motor planning. Getting on and off the horse, as well as transitional position changes on the moving horse, supplement motor planning activities. The equine environment offers multiple challenges and motivators not available in a traditional clinic. These include walking steep inclines that lead to a horse, or maintaining balance while providing the horse with a treat. Taking advantage of the sensory motor input of the horse, the therapist may then work on functional skills that further enhance permanent motor learning. All of these activities, either on the horse or in the environment, are structured to meet the patient's therapy goals. Occupational therapy. Occupational therapy is client-centered and depends greatly on what each client needs for functioning in his or her daily life. Occupations may include ordinary activities of dressing, eating a snack, reading the paper, driving a car, and telling a story. Occupational therapy focuses on those tasks that may be difficult to do because of a myriad of problems. With the horse and horse environment, an OT may focus on sensory processing through sequencing tasks, various tactile surfaces, visual motor integration, or listening and responding to graded directions.
You do it. Do it. Do the hoop.
Because being on the horse or in the horse environment is sensation-rich, many clients benefit from this integration of visual, motor, olfactory, auditory, and tactile senses. An OT may also work on cognitive tasks, such as planning an activity, following the steps, and cleaning up the area.
Try and pinch it.
Often fine motor activities, such as reaching for a ring or tossing a ball into a basket from the horse, can develop coordination and challenge balance, as well as focus attention on the task at hand. Grooming activities with the horse may facilitate self-care and motor development, as well as learning the body parts, colors, and numbers, which transfers directly to school-related tasks. For people with physical impairments that make everyday functional tasks difficult, mounted sessions provide a movement challenge which builds core strength, stability, and balance as a foundation for occupational performance. The OT may also focus on functional skills, which address specific upper extremity impairments, and integrate them with the rhythmic postural challenge afforded by horse movement. Manual tasks similar to those the client needs to perform at home, at work, at school, or on the playground are employed in the therapy session on the horse to facilitate practice of fundamental skills. The rhythmic movement of the horse at the walk facilitates occupational performance of many different skill sets. Occupational therapists may also engage clients in appropriate social and emotional behaviors in the equine environment by having expectations and rules to follow, facilitating team skills, and setting up situational role plays to develop proper social engagement. After a mounted session in which equine movement has challenged and enhanced the client's ability to perform functional tasks in a movement context, everyday functional tasks can be added into the session on the ground. This creates an immediate link back to the performance needs of daily life. These tasks could be removing the helmet, which requires a pinch grip on the clasp. The client could brush the saddle area, comb the mane, or brush their own hair in an effort to carry over skills learned in this environment to more functional activities of daily living. Even changing to clean clothes to go to dinner or putting on a coat will require fastening buttons or zipper, using the skills practiced while mounted. Helping the therapist to collect treatment equipment and putting everything away, and even remembering to do it all in a planned sequence, can reinforce skills that were learned while engaged in equine movement. This translates to enhanced life skills that improve performance in the client's everyday life and home environment. For some clients with ADHD, for example, planning an activity and then focusing on and executing their plan can be quite difficult, interfering with their daily lives. Tasks that are left unfinished or messes that are not cleaned up frustrate many parents and teachers. The environment in the barn provides many opportunities for planning and executing activities related to the horse and the therapy session.
Like Tall Neil?
This is just like Tall Neil, isn't it?
Occupational therapists will engage advanced clients in preparatory activities to plan and sequence their treatment session or assist impaired clients to remember and execute 2 to 3 step directions while on the horse.
Trade with Sarah and shoot the green ball.
The treatment sessions on the horse or in the equine environment can be very complex treatments where clients will improve their executive function skills. Speech-language therapy session. Equine movement can be used to facilitate the neuromotor systems that support speech and language function. Prior to targeting specific speech articulation tasks or receptive expressive language use, the speech-language pathologist can use a period of measured equine movement to promote improved postural control and overall stability. This, in turn, facilitates oral motor jaw stability, respiratory support for speech sound production, and enhanced sensory motor performance throughout the articulators. Equine movement has also been shown to positively impact arousal and general information processing, such that decoding and encoding of language can be positively influenced. Standard speech and language therapy strategies are then overlaid on the movement of the horse, either dynamically or statically, to address the client's communication needs. The setting is rich in naturalistic conversational context and communication opportunities, which then provide the speech-language pathologist with both naturally occurring communicative interactions and the opportunity to create specific speech and language tasks both on the horse and off the horse. Evaluation and treatment planning are no different when hippotherapy is part of the treatment plan. The speech-language pathologist conducts a formal speech and language evaluation using standardized assessments appropriate to the client. Examples include the Arizona Articulation Test, the Preschool Language Scale, and the Comprehensive Assessment of Spoken Language, as well as functional communication probes and speech-language sampling within the therapy sessions. Treatment goals will be consistent with goals written in any other clinical application of speech-language therapy. In reality, the speech-language pathologist is simply harnessing dynamic movement to promote a positive systems-wide neuromotor influence on human communication performance. The pragmatically loaded environment inherent in hippotherapy offers added opportunities for the treating therapist to incorporate real-world speech and language tasks and training. Interdisciplinary interaction. Occupational and physical therapy and speech-language disciplines often incorporate similar activities to provide opportunities for specific emphasis on functional goals unique to the client. The functional goals of the client become an interdisciplinary focus, where teamwork and co-treatment allow a more integrated and comprehensive plan of care. Evidence and research. Research into the effects of hippotherapy has expanded greatly in the past decade. Currently, there is evidence that equine movement improves postural control, balance deficits, and reduces fall risks. Other research suggests equine movement facilitates normalization of tone and reduces adductor muscle asymmetry. Many of these same studies have shown that positive changes in body structure and function following hippotherapy translate to improvements in activities such as the ability to dress, walk, run, climb, reach, feed, write, and other activities of daily living. Additionally, some studies have documented positive changes in self-confidence, self-efficacy, and participation in life occupations. Because most of these studies have been pilot studies or studies with small sample sizes, research continues at physical therapy, occupational therapy, and speech-language pathology programs across the country and internationally. This ongoing research investigates the efficacy, effectiveness, intensity, and outcomes of hippotherapy as a treatment strategy within the equine environment. Many hippotherapy studies are quantitative studies. However, qualitative data also provides useful information. One qualitative study of children and adults with cerebral palsy demonstrated that patient perceptions of outcomes are also important.
With cerebral palsy, she has tightening in the muscles, which they call spasticity, and that is controlled with the therapy that she gets on the horse by being able to get that stretch, once a week that you don't get sitting in a chair or even by stretching every night. We can't get those specific muscles that way and also work them at the same time. And so it's just a wonderful therapy.
Although this research provides promising evidence that hippotherapy is a viable option for the therapist's toolbox, hippotherapy is not appropriate or safe for everyone and every diagnosis. There are a few conditions for which it is contraindicated. Examples include atlantoaxial instability, osteogenesis imperfecta, tethered cord syndrome, and Chiari malformation. Precautions also exist in which therapists determine the risk-benefit ratio of using the equine environment. These might include impairments such as poor head control and hip subluxations, or potentially harmful behaviors such as aggression toward people or animals. Additional training. Because horses are part of the treatment team, Therapists who wish to use hippotherapy as a treatment strategy need specialized training. If the therapist has had limited exposure to horses, it is recommended that they take riding lessons and learn more. Additionally, the American Hippotherapy Association provides courses to train therapists in basic equine skills and treatment principles. These courses include instruction in understanding the impact of horse movement on the patient, the effects of using various types of equipment to reach therapeutic goals, and care and training of the hippotherapy horse. For the more experienced practitioner, there are courses offering ideas and approaches to use the equine environment to treat sensory processing disorders, communication disorders, and neurological impairments. For more information about courses, visit the American Hippotherapy Association at americanhippotherapyassociation.org.